Hello everybody, this is Gary. Today is Thursday, February 9th, 2023 at 6:14 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today I'm not doing too bad. I went out for my physical therapy and walking exercises. The weather kind of sucks here in Rochester, New York. It's raining outside. I'm making this video as part of my daily schedule. I already did some meditation twice today, and I did some work on my computer. I do consumer surveys for extra money. As far as my psychiatric symptoms, they're not that bad. My paranoia levels are not that high. My delusions are not that strong. My auditory hallucinations are at a bare minimum. My depression isn't that bad. And my anxiety levels are pretty low. Tomorrow I am seeing my peer support specialist at my mental health clinic. That is somebody who has a mental health diagnosis but works on staff as a counselor. That's in addition to the professional psychotherapist that I have and the psychiatrist that I have at that clinic. My psychiatric symptoms are not that bad today. I'm taking it one day at a time. Winter is always a little tougher than spring and summer. The winter tends to bring on more my physical pain from arthritis and the knee surgery that I had. The colder it's outside, the more physical pain I go through. A lot of people with arthritis and pain go through that. I take several different medications for physical pain. One is Cymbalta, which is an antidepressant, but it helps control certain types of joint, muscle, and nerve pain. I'm also taking Tylenol, Motrin. I take Flexeril for muscle pain. And I take Neurontin for physical pain as well. Of course, none of those drugs are opioids. I don't take any opioids for pain. But I am seeing my psychotherapist next week, and I'm seeing my psychiatrist in about 3 weeks. I just saw him last week. We made no changes to my medications at all. Somebody asked me what's the difference between schizoaffective disorder and schizophrenia, and which one do I have? Well, technically I have schizoaffective disorder, but that's on the schizophrenia spectrum disorder, so it's technically schizophrenia. That's why I use the term schizophrenia in my video titles. But the medications I take are both used as antipsychotics as well as mood stabilizers. I take Seroquel, which is an atypical antipsychotic, but it also works as a mood stabilizer since my schizoaffective disorder has bipolar mood swings to it, as well as the psychotic symptoms. I take Zyprexa as needed for extra paranoia and auditory hallucinations. Like I said, I take an antidepressant for physical pain. I'm on a bunch of other drugs, which I can't list them all here. But I did see my primary care recently, and we set up an appointment for me to see a pulmonary specialist because I have pulmonary fibrosis in my lungs, which is scar tissue that forms in the lungs and makes breathing more difficult. I don't know how bad it is. They caught it on a CT scan that was done for another purpose. They were looking for internal bleeding in my abdomen, but the scan caught my lungs as well, and it showed that I have pulmonary fibrosis. Pulmonary fibrosis is usually something caused by some sort of chemical irritation, and sometimes they don't know the cause of it, and it's called idiopathic pulmonary fibrosis when they don't know the cause. The only chemical that I can think of that I've overused that may have irritated my lungs is using Clorox bleach to clean my apartment, and breathing in the vapors. Not intentionally, of course, but over time. That's the only thing I can think of. But I do get out of breath when I go for walks or exercise, and it doesn't have to be very strenuous before I start to get out of breath. Um, so I won't know anything until March 28th when I see the pulmonary specialist. They'll run some sort of test to see what the strength of my lungs is and breathing, and then I'll talk to the doctor afterwards. And in the meantime, I'm just trying to hang in there and take it one day at a time, continue to exercise, but not overdo it. I'm not smoking cigarettes. I haven't had a cigarette in well over 12 months. So I don't think it's cigarettes that cause the pulmonary fibrosis. Pulmonary fibrosis is not cancer. It's technically not emphysema, but it can spread if whatever is causing it continues to irritate the lungs, or it can spread without knowing what the cause is. So that's all the report for now. Like, comment, share, subscribe.